A child can also be delivered by caesarean. The caesarean can be performed at a hospital as a planned or acute caesarean. A planned caesarean can in some pregnancies be the delivery method that doctors deem most suitable for the mother or child. For example, this can be because the mother or child has a known illness or the mother has given birth by caesarean before. In Denmark, Norway and Sweden, 10% of all births are performed by caesarean. An acute caesarean is performed during the birth itself if the delivery shows signs of becoming dangerous for the mother or child. It may be that the birth is too stressful for the child, affecting its heart rate, or that other situations arise where it is best for the child to be delivered within a very clear time frame. In Denmark, Norway and Sweden, 10% of all normal, planned births are performed by acute caesarean. A caesarean is always performed in an operating theatre. An operating theatre is a large room with plenty of space for the pregnant woman in the middle of it. There are at least 7 professionals present at a caesarean, including doctors, nurses and midwives. The woman is anaesthetized by an anaesthetist. Generally, an epidural analgesia is administered, and the woman is only completely anaesthetized in rare cases so that she can sleep during the operation. An epidural analgesia is administered while the woman sits up on the operating table, leaning forward. The anaesthetist will locate a specific point between the vertebrae in which to administer the epidural. An epidural relieves pain from the navel down and lasts for a few hours. A side effect of an epidural can be that the blood pressure is drastically lowered. Therefore, the woman's wrists are supported by armrests while she is on the operating table. Her blood pressure is measured every 5 minutes, and medicine is administered into a catheter in her hand. 2 obstetricians are responsible for the stomach operation and for taking the child out of the uterus. A surgical nurse assists the doctors with the stomach operation. An extra nurse assists with any practical matters. A midwife stands next to the obstetricians and takes the child. A paediatrician is sometimes on hand to help the baby if necessary after the caesarean. A caesarean is always performed with the mother lying on her back on an operating table. The table is tilted slightly to one side so that she doesn't lie directly on any major blood vessels. Fluids and medicine are administered into a catheter in her hand.